Welcome to Invisibly Unwell. I'm your host, Paige Lavelle. I've spent the past 2 decades climbing the corporate ladder. I've worked hard to get where I am professionally, but there's a side of me that few are aware of. I am also an autoimmune warrior, an eating disorder survivor, an author, and now a podcast host. My goal here is to educate and empower high-achieving women navigating autoimmune conditions and other chronic illnesses, who at the same time are also dealing with challenges that all high-achieving women face, like disordered eating, perfectionism, and people-pleasing. Invisibly Unwell is what I wish I had at the start of my journey. You are not alone. I hope my story and the stories and expertise of my guests will provide you with knowledge and ideas and empower you to share your own story and advocate for the life you've worked so hard to build. Quick disclaimer, this podcast is meant for general information purposes only and should not be taken as a substitute for medical advice, diagnosis, or treatment. Today's guest is acupuncturist Lea Manilla. She has a double master's in acupuncture and herbology, labeling her as a diplomat of Chinese medicine. Lea found acupuncture at 15 years old after suffering a shoulder injury as a competitive swimmer. Not only did acupuncture heal her shoulder, it opened up new possibilities for both current performance and a future passion. Lea's mission as an acupuncturist is to provide a safe haven for each person who walks through her door. She strongly believes everyone has an innate ability to heal themselves, and it is merely her job to help direct them down that path. I'm a little biased because Lea is my acupuncturist, but I strongly feel that she is achieving this goal. She feels that acupuncture is an invaluable support in helping us to achieve supreme health and well-being, so we can just live better lives. She dispels some myths around acupuncture. She also shares that it can help with so many different conditions. Often people don't realize that there are benefits around anxiety and emotional imbalances, digestive and respiratory issues, insomnia, women's health. I can personally attest to how much acupuncture has helped as one tool that I use for a lot of my chronic illness conditions. If nothing else, I hope Lea's story and her expertise today open your mind to the world of acupuncture and Chinese medicine if it's something that you haven't been exposed to yet. All right, so welcome, Lea Manilla. I really appreciate you coming onto the podcast today.
Thank you. Thank you so much for having me. I am very excited.
Yeah. So one of the biggest tools I have in my arsenal for healing and for just general great mental, physical, emotional health overall is acupuncture. So I'm really excited. Obviously, I'm biased since you are my acupuncturist that I see. I'm very biased to your skills and your background and your knowledge.
Thank you.
Of course. But I would love to hear a little bit about what got you first interested and exposed to acupuncture? And from there, what made you determine that that was the path you wanted to go down professionally?
Yeah. So I am about to turn 30 and I was first introduced to acupuncture when I was 15. So 15 years ago, my journey kind of started with it. I was a competitive swimmer. And at the time, 15, 16 years old, you're starting to look at colleges. You were a swimmer, it's that point where things start to get serious and you're really competing at a high level. So the pressure was on. And at the same time, I had a shoulder injury, rotator cuff tendinitis in my right shoulder. I had decreased range of motion. It was affecting me every day at practice. And I was really in a lot of pain. My uncle is an orthopedic surgeon and I went to go see him and he was like, you can do physical therapy. It might increase in pain because you're exercising so much every day. And if it continues to be so inflamed, you might need surgery. And that, of course, I was 15, I had never had surgery before. And with college on the horizon, I was like, there is no way that I want to go down that route. What else can we do? And at the time, my mom had a herniated disc in her neck and she was in such severe pain. And someone in her small circle suggested acupuncture. And she went to our local acupuncturist in New Jersey, and she walked out of that appointment feeling amazing with so much relief. She could not get over it. And so she was going pretty religiously at the time. And so she asked me to go along with her. Now, again, I was 15. I had no idea what acupuncture was. I had never heard of it before. And I was a little intimidated by it. I was like, what? They stick needles in you? That is just crazy. How on earth does that help? But my mom, being the strong woman that she is, was like, you are coming with me and we're going to figure this out. And thank God I listened to her, because after one appointment, I felt so much relief, to the point where I was like, not enough where there was no more pain, but enough where there was a decrease in intensity of the pain. And I was like, whoa, this stuff is really cool. So my mom and I kind of became a ritual for us. We would go at 5:30 in the morning before school, because after school was swim practice and homework. And we would go, and just twice a week for several weeks. And after probably a month of pretty consecutive treatments, I was completely healed. I had full range of motion. I remember my swim coach being amazed at how my pain was just gone. So it was kind of at that point where I was just fascinated by it, and I loved it. And I wanted to keep up with it, even though I was feeling really good. And I wanted to just kind of explore what else it could help with. And I also suffered with anxiety at the time. My anxiety, I mean, I've been living with it for 15 years now, but it kind of...
Haven't we all?
Yeah, right. Who hasn't? But it kind of crept up around the same time. And my acupuncturist really helped me to manage it and started treating me for my anxiety. And I just thought it was so cool how there's so many different things that acupuncture can help with, not only from a physical standpoint, but also an emotional. And I remember it being like, again, 5:30 in the morning. And I looked at my mom after our appointment, and I was like, I think this is what I want to do. So I went to college at Gettysburg College. I swam all 4 years there, never had a shoulder injury again. And I majored in psychology, because acupuncture is so just mind-body connection. So I figured, you're working with people every day. Everyone has baggage. Everyone has different emotional states, and acupuncture can help so beautifully with that. So let's take the psychology route rather than the health science, organic chemistry, pharmacology, all of those crazy classes that aren't really necessary for acupuncture. And then I graduated in May of 2016, and that September I entered Pacific College of Health and Science in Manhattan. And so I studied 4 years there, and I graduated in 2020 with a double master's in acupuncture and herbology. And then I started practicing. So it's been quite the journey.
Yeah, that's incredible that you knew at that young of an age. I feel like a lot of people didn't have, myself at least, exposure to the world of acupuncture and Chinese medicine until I was much older.
Right.
No fault of my parents. They were just raised in you go to the full Western approach all the time.
Right.
I even heard a lot of misinformation around if I were to seek out, which now I do seek out chiropractic care. I heard that rumor that's been spread over the years of if you go to a chiropractor, they're just going to make it so you have to keep going. Right. So it was
well, that's
anything, exactly, like anything that is more of just managing your health at that holistic, ongoing maintenance, making sure your nervous system is operating properly and not in a constant fight or flight state,
right?
Which is something that as like a high achieving female struggles with anxiety and perfectionism. That's where I wouldn't say natural, because obviously there's a lot of environmental and societal factors that contribute to that. But if I'm not mindful, I can end up in that fight or flight very easily.
Oh yeah, we all can.
Yeah. So I very much appreciate that it's something that you felt connected to at a young age and something that you saw as your path and you kept going that direction.
Yeah.
I also love the psychology piece around that. So really trying to understand the mental and emotional impact that it has on patients.
Right. Well, so two things. I do have to give credit where credit is due. I really do give it all of the credit to my mom. She is the reason why I found acupuncture. I'm not a business person. I do not have a business mind at all. I knew that I could, my dad is in the finance world. It's like a different language to me. I knew that I would not be that type of career, but I had no idea what I wanted. And when I went for acupuncture, I love helping people. I love interacting with people. I love connecting with them on a deeper level. And acupuncture really just helped open that door for me. I really give all the credit to my mom. And I wanted to go off of something else you said, but it's slipping my mind. The psychology part.
Yeah, there we go.
Yes. That, Gettysburg College is a small liberal arts school. They don't have a pre-med program. So knowing that I wanted to do acupuncture at such a young age, I kind of wanted to do everything in my power in undergrad to prepare myself for the field down the road. So truth be told, I went into college thinking I was going to major in health science, and it was freaking hard, and I did not enjoy it. And there were so many classes like organic chemistry and just a lot that aren't necessary for Chinese medicine to really understand and be able to practice it. So I was like, why am I putting myself through this? I love psychology. I was taking a couple introductory classes, and really acupuncture is such at a deeper level, and connecting with patients at that deeper level is so important for the medicine and for their response to the medicine. So I ended up going the psychology route, and I don't regret it one bit. It really helped in so many different ways. And I loved learning about the mind-body connection at that age, and then bringing what I learned in school with me to graduate school. So it kind of all came together pretty beautifully.
Yeah, no, that's wonderful insight into your perspective of the practice and how it kind of fit into your life path. One thing I'd love to hear, it's kind of a two-part question. So one of the things I love about working with you, after having first explored acupuncture probably a decade ago, maybe a little longer, and having gone to quite a few different practitioners, I've lived all over. So obviously you have to find a new person to work with when you move across the country multiple times. But one thing I really love about your position, and something I've talked about on the podcast many times, you're often left in a position as someone with chronic health issues or any health issues really, where if you're exploring what I use the word alternative with air quotes because I don't like the connotation it has, but if you're exploring more holistic alternative methods or healing modalities, it's often that you're left in the middle of an adversarial relationship between people in that school of thought and that practice and people that are very aligned with the purely Western medicine, prescription, surgical approach.
Right.
And so I believe after lots of trials and tribulations, bad decisions that I've made over the years and having to learn the hard way, that for me and for many people, you have to find your own middle.
Absolutely.
I have to take medication for my Hashimoto's thyroiditis. Is that always going to be the case? I don't know, but that is a reality that I am comfortable with now. But I also love to have the tools and the other healing modalities available to me that were not presented to me in a standard medical setting.
Right.
So I love that when I come to see you, you're someone who understands that this is part of a larger toolbox or a larger set of things available to a patient who's dealing with any sort of health issue, mental, emotional, physical. In many cases, I don't know if you can relate to this. I first had the physical ailments that I was aware of, and then that forced me to start to dig into some of the mental and emotional things that were being buried. So I really appreciate that you take that perspective. So I'd love to hear just your thoughts about how there can be some balance between these much older Eastern approaches to health and the more traditional Western approach that most of us or most people listening to this are more familiar with.
Right. Yeah, absolutely. Well, first of all, thank you for saying that. That was so kind. But I mean, I'm sure I've said this to you, and I always say, and I preach to my patients that Eastern medicine, Chinese medicine, is so wonderful for what it is, and it can do so many amazing things and help the body in so many different ways. And then we have Western medicine, and Western medicine is so wonderful for what it is, and we need Western medicine. And when you combine the two of them, you can see amazing results. And I think you, through your experience, have kind of been a good advocate for that, right? You have to take medication and you've come to those terms, but you also have now incorporated acupuncture and more holistic approaches to feeling your best, right? So when you combine the two of them, you really can see wonderful things. One is not better than the other. They are so different. And like, if you were to say liver qi stagnation to an MD, they would be like, what on earth are you talking about, right? That's a Chinese medicine diagnosis. It is so different from anything in the Western world, but it doesn't make, one is not better than the other. And I firmly believe that when you combine the two and use them in conjunction, they support one another in amazing ways. So for example, people with chronic pain, right? If they just come for acupuncture, they might see results and it might be amazing and it might be this miracle for them, but they also might not. And there might be other missing pieces that they need to kind of form the whole puzzle. So, I always say, if you're coming for acupuncture, also see your physical therapist, also see your chiropractor. If you have to take medication, don't not take that medication, right? It's all it will come together to help in regards to pain. We'll continue with that. Like, it can help to decrease increase range of motion and decrease inflammation and pain. There are so many ways that these different modalities working together can help to speed up your healing process and support you in a way that if you weren't doing them together, it might not. It can also be as intense as someone undergoing cancer treatment, right? If someone is in chemo, we need the chemo. We need those Western drugs to kill this cancer, but they are strong extremely intense where they are hurting the body in other ways. If you turn to acupuncture while going through that process, it can help to support your body and strengthen it. So maybe the side effects aren't as intense. So there's so many different things, but different aspects that it can help with. But I am a firm believer that Western and Eastern combined is the answer to it all, right? I always tell my patients there's a lot of different puzzle pieces. You just have to find all of the ones that mesh together to create the picture that you ultimately want. So yeah, and it's a different formula for every person.
Yeah, I was going to say, everyone's puzzle is going to look a little bit different. I know people who have found a combination that works great for them, and if I did the same thing, it would not move the needle for me.
Exactly.
Pun not intended with the needle, but yeah.
Good one.
So to dial it back a little bit for anyone, I feel like most people, they know the word acupuncture, right? They know that it involves placing needles throughout the body, but understanding it's a 4-year degree and very in-depth, and there is a lot of information and history that goes into it. Could you, at a high level, for someone who's all they know about is acupuncture, is that where they stick needles in you? Because I've had people ask me that exact question before. Right. Could you explain at a high level just what the practice of acupuncture is and where that thought process and how that impacts your physical, mental, emotional health, where that comes from? Yeah.
So yes, we are sticking needles in people. But what we're doing is we are resetting the nervous system. Right? Kind of in simple terms, we're bringing what you said before, our body from this constant state of fight or flight into rest and digest. And when we are able to bring our body into that calmer state, everything is then able to function optimally. So that's why acupuncture, there's over 100 clinical symptoms that acupuncture can help with, and that number is consistently growing. So that's the main reason as to why acupuncture can help with so many different things, because we are really resetting our nervous system. It's a shock to our nervous system. We're creating these little micro traumas through the needles, and your body's like, oh my God, what's going on? Going to that needle, increasing circulation and blood flow, and really just helping to reset the entire nervous system. So we are working to just help everything function optimally. We can, in regards to sleep, we can help to regulate the circadian rhythm. And acupuncture helps to produce the neurotransmitter GABA, which helps to relax the mind. In terms of stress, acupuncture really helps to reduce our cortisol levels, which are our stress hormones, and increase our happy hormones, which are dopamine and serotonin. In terms of inflammation and pain, right? Acupuncture is increasing blood flow, increasing circulation to that area, which is helping to decrease inflammation and therefore the pain that you're experiencing. Even digestion, it helps to strengthen your digestion and regulate bowel movements, can help with bloating, gas, acid reflux. There's really so many different things that acupuncture can help with, and it's because we are working directly with the nervous system. And, in today's world, people are in fight or flight every day. Like, it's just stress back in the day used to be like what we were taught at school is fight or flight, like you're running from a bear, right? That's what stress used to be back in the early, like BC years when acupuncture was first created thousands of years ago. But now it's like stress every day. People have anxiety, people have depression, people have high stress through little situations or big situations, and it affects everybody's body differently. And then things start to shut down, and we're not living in that balance that we should be to be feeling our best. And so acupuncture just helps to kind of shock, reset, and bring you back into this state of flow and balance to help everything function better.
Nope, absolutely. And what kind of jumping off of that? So I'm familiar, obviously I've done a lot of research on my own and have been seeing acupuncturists for quite some time, and it's truly helped with my nervous system. I think I've been in the banking and the fintech world for a very long time, and it is a very hustle-minded, every request is urgent, finish it as fast as you can. If you don't do it, someone can replace you. It's just a very cutthroat type of
word I was going to use.
Yeah, it's very cutthroat, and it's very not to dig too deep into the masculine feminine, but like it's very masculine type of environment, and it's very much there's not time to feel. There is not time to kind of set yourself into like a positive mental state. Now, I do take time, obviously, to do breathing exercises. I try to do yoga. I need to be better about it. I used to be very diligent with my boundary setting around having time for those practices.
Good.
But when you throw yourself into corporate roles that are very highly demanding, and I will expand beyond corporate. I have friends who work in hospital environments that are extremely stressful.
Totally.
In fact, they when they share what they dealt with on a given shift, it makes me laugh at the stuff that I've been stressed out about, because I'm like, you're dealing with real stuff. I'm dealing with like compliance issues and things that are problematic, but no one's going to die as a result of something.
Right.
So it's a very, it's almost just accepted that you are in this high stress state at all times. So acupuncture is something that really helped me recognize when my body is just aflame with that anxiety and that fight or flight, and that it's something that you have to be very intentional and consistent and mindful of because of the impact that can have to your body over the long term. That said, it's needles. I don't think I'm a rare person I don't love to be poked with needles. I have most of my life I've had an autoimmune disease. And so I had to get over it really quickly. Honestly, it was like life's exposure therapy, because I had to get so much blood drawn that as a 12-year-old, I remember thinking in my head, like, you need to get over this or you're going to have a panic attack every time you come to the doctor's office. So that's how I got over it. I still cringe when they're like, oh, you're due for a booster shot. And I'm like, oh, they're going to stick a needle in my arm.
Know.
But I know there are some understandable misconceptions when you hear that we're placing needles all throughout your body. I'd love to hear just if you can shed some light onto how it's not the same as getting blood drawn or getting a shot. We're used to the much larger needles. And just any other misconceptions you've heard or that you've addressed with someone who speaks to you or that you've heard out in the world. Just say something that's not super well informed about the practice of acupuncture or Chinese medicine.
Yeah, absolutely. And, it is very interesting. Like acupuncture is pretty well known and there are a lot of people that practice it, but there's so much more who don't know anything about it. So I am still very amazed when a patient comes in or just having a casual conversation with someone and they know absolutely nothing about acupuncture. So there's definitely many common misconceptions. Probably the main one being that it hurts. It should not hurt. I do not practice in that way. I personally don't even like the way the needles feel. So I don't want to elicit that sensation or any sort of pain onto someone else. And I truly believe that, yes, the needles are doing their thing and pushing your body in the direction of healing. But if you're in pain when you're sitting on the table and that's all you're thinking about, you're not able to relax, which then the needles aren't able to perform to their highest ability. So I would say the most common misconception is that the needles hurt. They are as thin as a dog's whisker. So they are nothing like a shot or an injection or getting blood drawn. They're as thin as a dog's whisker. They are completely solid. So nothing's going into you, nothing's coming out. They can be as small as 1/2 inch or as big as like 5 inches. We use that pretty rarely, usually like in the glute area for really big muscles. And the needles, as thin as they are puncturing through the skin. So you can feel like a slight pinch upon insertion, but that would dissipate in a second or two if you feel it at all. And then when the needle is in the point, a lot of kind of common sensations are pressure, heaviness, a warming sensation, sometimes tingling or electricity, sometimes a muscle twitch. That's very common. So nothing that really should be painful. Sometimes people feel it like traveling down the channels. I personally love it when that happens. That means we got it. It's good. It's a good point. Your body needed it. But again, some people don't like that sensation. So I believe that if you don't feel that sensation, it's okay. The needles are still going to do their thing. I just want you to be as comfortable as you can be. So yeah, I think the most common misconception is that the needles hurt. I think another one is, I've honestly never seen a movie with acupuncture in it, but I know there are movies out there, and I know that there's like the people are covered in needles head to toe, because I have had patients be like, how many are you going to put in me? It is not like that. I believe less is more, and I think a lot of other acupuncturists do as well. I personally average like 15 to 20 needles per treatment. So again, like a lot of people come in and they are afraid with how many needles will be inserted, but just a handful. The channels on the body run head to toe and toe to head. There's over 350 points on the body, but we really only stick to 15 to 25, we'll say. If I'm going over 25, I'm like, okay, we're good for today. But yeah, I think those are probably the two most common misconceptions. And I will say too, another one actually is what exactly acupuncture can help with, right? I think people mostly know that acupuncture can help with pain, but I don't think people know the realm of things that acupuncture can help with. So I love when I have patients who are coming in for something like pain, and I go through what we call the 10 questions. We kind of go head to toe, ask as much about you as we can to learn as much information possible to be able to come up with the most accurate Chinese medicine diagnosis. And when I ask about sleep and I ask about digestion and I ask about stress levels, and people are like, oh, acupuncture can help with that. oh, it can help with my migraines. Oh, it can help with my anxiety or depression. It can help get my period back. Like there are so many different things that people don't or aren't aware of that acupuncture can help with. So I don't know if that's really a misconception or if that's just an unknown. But
I think that's great to add though, because I personally only knew about it for chronic pain. Growing up, that's what I heard. So I appreciate you shedding light on the other things. Like I don't see you as an acupuncturist for pain.
Right.
So there's all these other benefits that it has. And I think that the few times people have asked me, because I share that it's something that's really helped me for a variety of reasons. I went because of the autoimmune symptoms, and then it ended up helping with anxiety, with depression, with all sorts of other things that other, the main group that I make this podcast for, like high achieving women who kind of put themselves through a lot of stress, career wise in their personal lives and professional lives. It's just helped in all these other ways that I didn't go knowing that it would be impactful to those particular assets of or facets of my personality and my life. So I appreciate you shedding more light on that.
And I think a lot of people are in that situation as well. And I always say, if a patient is coming in for pain, we want to look at two main things: the intensity of the pain and the frequency of the pain. And we want to make sure, in order to measure that the treatments are helping, we want to make sure that that intensity is decreasing and then that frequency is decreasing. But then I also say, look at other aspects of your life. Look at your sleep. Are you falling asleep easier, and are you staying asleep the whole night? Look at your digestion. Are you having more regular bowel movements? Is your bloating decreased? Look at your stress level. Are you not carrying your stress physically anymore, right? I mention all of these different aspects because that also tells us, yes, okay, you're coming in for pain, but if your sleep is also improving, then the acupuncture treatments are working in another way as well. So there are some people, unfortunately, who come in and might not see relief in their pain, for example, but see relief in other aspects. And that it shows us, okay, it's not really working in the way that we wanted it to, but it still is working, and it still is helping you to be the best version of yourself so that you could live the life that you want. And it just takes a lot of steps to get there, but it's really interesting.
Yep, absolutely. I would love to hear a little more about, just given that most of the people I talk to, this is obviously an inclusive space for anyone who's dealt with any invisible issues, chronic illness issues that if you're walking down the street, the average person would have no idea you're experiencing. So I can go ahead and loop in the mental and emotional issues that you and I were talking about. I don't think we all wear anxious tattooed on our forehead. You could hang out with us a few times and kind of piece it together, but it's not something we walk around advertising. What have you found in working with patients and being in a practice for many years now? Or at least, you've been out of school for quite a few years, so you've had quite a bit of real world experience. Year,
so still somewhat in the beginning, but we're
very well educated and experienced, especially if you worked anywhere near New York City as a former New Yorker. Talk about a place that you're going to find people with a lot of anxiety and type A behaviors. So I'll talk specifically. It's something I talked about more recently on the podcast. So something that I've been dealing with and that I've opened up to many friends and now have shared it on the podcast, like fertility issues or something that a lot of high achieving women face. And I think that had I not already been utilizing acupuncture to help me with my chronic illness issues, it wouldn't have even occurred to me to seek out acupuncture or to contact an expert to see if that's something that could help with any sort of fertility issues or issues with the cycle, anything that a lot of women just grin and bear it and deal as we've been trained to do. How is acupuncture, and also you feel free to speak to the Chinese herbal side of that, Chinese medicine. How can that help with those specific issues that many women deal with? Okay.
So at our practice specifically, we do specialize in women's health. So we treat a lot of it. We're kind of taught in today's day and age that periods are painful and takes a while to get pregnant. And, you're supposed to have cramps. You're supposed to have breast tenderness. You're supposed to be bleeding heavily, and you just have to deal with it. And I know, back when we were growing up, kind of go to your OBGYN and they just kind of mask it with birth control. And it really wasn't until I became a student and was looking or learning about acupuncture that that's not how it's supposed to be, right? We're supposed to have pretty seamless periods and have regular cycles, and we shouldn't mask it with birth control because then we can't get down to the root as to why our cycle is off. Every woman that walks into the office, whether she's coming in for pain or fertility, obviously, or any kind of other issues, headaches, you name it, we always ask about their cycle because it tells us so much from a Chinese medicine perspective. We love all the details. We are very detail oriented in Chinese medicine. So we ask specifically, how many days do you bleed? Is it regular? What is the blood like? It all tells us what are some symptoms that you experience. Do you have increased headaches around your period? Do you have increased stress? Are you suffering emotionally during that time? Right? There's so many different things that kind of contribute to telling us about a woman and kind of what they're going through. So what we do as acupuncturists is we try to help women during their cycle, and we kind of look at each phase and how they feel during each phase and the experiences that they have during each phase. And it allows us to dig deeper into how we can help them overall to regulate their cycles, to not have pain when they're bleeding, to be able to live their life and not have to take off of work because they're experiencing such pain, or be able to get pregnant easily because their cycle's regulated. There's a lot of different ways that acupuncture can help.
And then leaning into the fertility aspect of women's health is that I've obviously asked you certain things about this because it's in my own medical history, but how can acupuncture, how can the herbal supplements that you're obviously very well educated on, how can those help to impact fertility? Both from I think one of the things I shared on a recent episode was I was always, which is funny because this is like the biggest passion project I have, is studying chronic illness that impacts women, especially high achieving women. And I felt very ill prepared for the fertility journey in the sense that I was always told, you have multiple autoimmune conditions, you are in your mid to late 30s, you are probably going to have difficulty getting pregnant. What I was not prepared for, and I think so many women are not prepared for, is if you have no issue getting pregnant, you have an issue sustaining it.
Right.
And it's something that, because you deal with things like an early loss, people tend to not want to talk about that because obviously it is not a super light, easy subject, but it's such a reality for so many women. And as soon as I opened up to people about it, they were like, oh yeah, I've had 3. I had someone tell me they had 5, and this was like a friend of mine. Wow. And I had absolutely no idea. So it's something that I feel like we have to take away the stigma for being able to share that. And I know that there's a lot of Eastern modalities, especially acupuncture and Chinese medicine, that can help. I'm not saying it's going to fix anything or it's going to be the magic pill, but can definitely help, as you were saying, kind of make your body stronger and able to kind of go through these trials and these difficult things, especially if you are going through like surgical procedures or medications that are a little bit strong, especially if there's hormonal medications involved. So we'd just love to hear any information you have or anything you've experienced with patients around what you've been able to do to help them as part of their overall fertility journey.
Totally. So kind of touching on what I was previously saying, we first really look at their cycle, which tells us a lot about what's going on. And if someone's not able to get pregnant, we treat what we say, right? Every person is different. There are so many reasons as to why someone might not be able to get pregnant, and it could be totally different from the next person. So we treat everyone as an individual and look at their individual cycles, look at their health history. But acupuncture, there's actually a study that shows that acupuncture in the first trimester can help reduce miscarriages by like 60%. So there's a lot of different phases kind of with the pregnancy journey that acupuncture can help with, from strengthen, like helping to regulate a cycle so that someone can help them to get pregnant, to increasing egg quality, right? And to helping with ovulation, help support ovulation so that someone is ovulating and the egg is actually in fact releasing, because sometimes people don't even ovulate, right? And acupuncture can help. And sometimes we don't even know. We're not really taught that, right? And it's kind of until you go through it. So
the stuff I didn't know about my cycle when I was like 35 years old is kind of alarming, but it's just something they don't teach us anything in depth. It's very much, at least in my experience, it was glossed over in school.
No, totally. And I think almost every woman, like, yeah, we're taught sex ed, but we're not taught anything about our bodies and what it takes to actually get pregnant. And it's not as easy as, we might have were taught back in the day. So so it can help with ovulation, and it can help at post ovulation. We always like to have someone come in to help to kind of strengthen the endometrial lining and to help with implantation. And then once a person is pregnant, we do like to continue to see them throughout the first trimester with very gentle treatments, but to help bring blood flow to the center to help make sure that the egg is healthy and strong and implantation is there and that mom is feeling good and strengthened during that time. And then also, if people are experiencing losses or have underlying issues that might be contributing to these losses, we want to continue to treat them during that time as well. And I truly believe that specifically just treating stress sometimes during this whole process can really show like incredible results, because sometimes, like going back to that fight or flight, if we're trying to get pregnant and we are experiencing these losses and having an extremely hard time with it, we are going to be affected emotionally 10 times over. It is not only physically taxing, but emotionally taxing. And if we can just work on, like from an acupuncture standpoint, calming the nervous system and helping to regulate those hormones that are needed for pregnancy, then hopefully we can see the results that we want. But there's a lot of different steps, a lot of different phases during the cycle, during the pregnancy journey. And ultimately the goal is to just keep the blood flowing to the womb to help build a safe and healthy baby.
Absolutely. And the one other question I would have, just given a lot of the subject material that I share on here, have you had any education or just experience with patients specifically to the benefits that acupuncture can have for chronic illness? Obviously, the stress that you've spoken to is a huge part of that. But I'd love to hear if you have any additional information or additional experience around someone who has a condition like myself, or if they're struggling with another autoimmune condition, since 75 to 80% of autoimmune patients are women.
Lovely.
If you've seen, yeah,
I did not know
it's
that.
so
factor.
fair, isn't it?
Yeah,
it's so
seriously.
Fair. It's crazy. I think the exception in the numbers is gout and type 1 diabetes, but the large majority are female. Yeah. There's a whole lot of different.
Easy.
So easy. It's crazy. Obviously said with sarcasm.
Yes.
But we're here to share our stories and hopefully less women feel alone. So
yes,
if
absolutely.
I can succeed in that, then I will feel like this podcast was successful.
Good.
But have you had any experience outside of myself, obviously, with patients who have seen some improvements in their symptom and just their management of chronic illness?
Yeah, honestly, yes. I will say, I mean, I've only been in practice, I don't want to say only, but 4 years in the grand scheme is not that long. And I've also worked at a lot of different places during that time. So wasn't able to really kind of be on a long journey with people. But I absolutely have seen results in patients with chronic illnesses. I've seen a lot of fibromyalgia. I've seen a lot of Hashimoto's. I've seen a lot of hyperthyroidism. So there's a lot of different conditions that people have been living with long term that, they don't see, or I at least haven't experienced it where where everything is as good as can be, but they have seen a decrease in their symptoms and they do feel stronger. They feel better. They feel healthier. They feel, that they're able to do their day to day without feeling so intensely as they previously were. So I know that's kind of a broad answer, but I don't feel that I have too much expertise in that area or experience. But from the experience that I have had, acupuncture is working with the nervous system, like I said before, and we're helping to regulate all hormones. We're helping to decrease inflammation. And yeah, people who live with chronic inflammation and chronic imbalance in their hormones, they do see changes. And again, we're not curing it, but we're helping, and we are working to help these patients be their best and feel their best and do what they love to do and be the best version of themselves that they can be. So that is my goal as an acupuncturist, is just to help every person that walks into my office to leave feeling better physically, emotionally, and feeling like they are or becoming the best version of themselves so that they can live the life that they want.
I think that's a wonderful focus and view and perspective to have on the practice. So thank you for ending on such a positive note.
Yeah, thank you.
All right. Well, I really appreciate having you on, Lea, and I would love for you to take a minute to tell people where they can find you, because I know you very recently went out on your own, which is very exciting.
Yes, thank you. Well, thank you so much for having me on. It has been such a pleasure and such a fun experience. But yes, I recently just started my own practice. It is called Better Days Wellness. I'm located in Rochester, New York, and anyone can find any information on my Instagram, which is at Better Days Wellness, and my website, which is betterdayswellness.com. So all of my information will be posted on there. Going to try and really get into the Instagram world, social media. We'll see how that goes.
Yeah, I struggle with that too, so don't.
It is,
don't worry.
Yes, it is a challenge, but I'm excited and looking very forward to what's to come. So thank you so much for having me.
Of course, it was a pleasure to have you, and thank you so much for sharing everything. I'm sure that people will have a lot to take away from this episode.
No, thank you. I hope so.
I really hope you enjoyed this episode of Invisibly Unwell. If you like the show, I'd greatly appreciate if you followed it, and if you left a review on Apple Podcasts, Spotify, or wherever it is that you're listening. This allows me to keep the show going and to continue to bring on incredible guests to share their stories.